you once again for joining us today. Continue to like and share when you're watching the show. One of the things that we would like for you to do is to go to your friends and invite them to come and watch this show right away as we are going live. And hey, to be honest with you, I encourage you to go back to last week's episode as well, because that was a dynamic episode talking about some great information. But I promise you this today, it is also going to be filled with a lot of information. Continue to like and share. And once again, if you got questions, do us a favor. Go to www.askdrpatrick@twwclinics.com and submit your questions.
And you can even comment below, because we always review them. Actually, as I'm checking my phone right now, if you actually make a comment or even a question
go ahead.
Sometimes we do get a little long-winded, but sometimes we can answer your questions right as you're doing it right there.
I can't imagine us ever being long-winded.
Well, we try to get everything in.
That's right. Well, here we go. Shall we get into today's episode, or do you have anything else that you want to say?
No, actually, it's kind of cool because this question comes a lot, and so we kind of culminated several of them and picked one of them that we think represents the best. So yeah, excited to go.
Here we go. Question number 1. Doc, I have watched all your videos and I love your show. Thank you for watching our information and Doc's stuff. So your material makes so much sense. I looked at your degree and it says that you are a doctor of chiropractic. Your information seems to be so much more than what a chiropractor does from what I know and have understood. Then when I go to my doctor for issues I'm having with my thyroid, what they say to me makes no sense, but your explanation of the thyroid and hormones does. I leave more confused than when I arrived. How is this possible? Why is there such a big difference between the two? Please help me understand.
Okay, that itself... remember, put your phone on vibrate. See, people are already calling in for more questions.
Yes, exactly.
Great question, because here's one thing, and I want to clear up some confusion that way, and really understand in great detail. Okay, what really makes actually the Wellness Way so special, for example, is its thinking. Nicole Selesky, okay, remember, she's an RN.
Yes.
Right now, the one thing that we encourage massively, and actually we send our doctors to different trainings, and the trainings, for example, most of them are actually medical.
Yes.
But what happens is, she's down there right now. She thinks like us. She approaches the seminar coming through the way we think, through our filter. Okay, that's the biggest key. Okay, because how you approach a problem is very different. Now, let me give you an example. Here, let's step back and let's ask some major stats. Cancer, heart disease, thyroid problems, infertility, everything all-time high.
Sure.
Nobody disagrees with that.
Right.
Statistically, okay? It gets worse every year. Yet we still approach the thinking the exact same way.
Yes.
It makes no sense. And see, so when I was going through school and being, my health history as a young kid that way, continuing to develop, what I wanted to do and how I wanted to actually see things come about, the current thinking of healthcare didn't help me. You know what I'm saying? And that's why we've created our different analogies for people to understand things that way. But here's the one thing. So how we approach any issue, from a thyroid to a GI to a hormonal aspect that way, comes from a different way of thinking. Now, let me give you a simple one. Basically, medicine itself actually acts like the body makes mistakes. Dr. Jacques did a really good job like this when he was talking about cancer last night. Your body doesn't make mistakes, okay? Your body, for example, does everything it can to survive. So let's approach this, okay? So as I started to actually get my education, I realized that a chiropractor, when I was actually starting to study it, actually gave me the best way of thinking. Now, this is where the confusion comes in. Now, this is going to make some chiropractors very happy. It's going to make some chiropractors very upset, okay? Because here's what happens. Our profession as a chiropractor is actually the way we practice it. No joke. The way that most people, 99% out there, practice chiropractic has molded into the medical thinking.
Sure.
I mean, how many times have people gotten adjusted and their pain not go away?
Right.
Because why? Because they said, well, take an adjustment, it'll get a headache. Take an adjustment, do these things. And it's a bad thinking. There's people that get adjusted all the time. Their pain never goes away because it's not the causal factor that way. Okay? And so they try to reference and try to compete with doctors. I'm like, why would you want to compete with stupid thinking?
Right.
Our next question is going to show you how stupid some of the doctors really think. Okay? So the thing is this. So being a chiropractor, as my thinking changed, and I started to approach the human body and how it works, and that's why even how we think today, I get asked to speak at big medical conferences.
Sure.
I've been asked to speak at medical establishments that way. I got asked to speak over at Aurora. Do you know what I'm saying? Because why? Because saying, listen, you have your thinking, we have ours. And for example, it said, and so when actually, now this came up in the question too. They say, well, doc, then, we just are hiring another nurse practitioner.
Yes. Absolutely.
And I got a couple applications, and what happened is one of them asked the question, said, Doc, I don't know anything about what you do. How do we learn? Guys, let me tell you this, okay? Any medical professional that works in the wellness way basically had to pretty much dump a lot of their thinking, and we had to train them. Let me give you an example, okay? The question, for example, she had brought up both thyroid.
Yes.
It's hilarious because I actually just pulled up the physician desk reference, okay? And the most common medication today given medically is levothyroxine, okay? Now, it's interesting because if you just type in the PDR and actually go and check out what's going on as far as like, what medication does and the contraindications. Now, a contraindication means this. If this is going on, you cannot take this medication.
Right.
For example, a contraindication for a vaccine. If you have an egg allergy, you can't have it. Who said so? The manufacturer of the vaccine. Most people have no clue about that. Most of your doctors have no clue about that. So let me give you one that's right from the PDR itself. Okay, contraindications, precautions. The first thing that they list about levothyroxine, a thyroid medication. Administration of levothyroxine to patients with uncorrected adrenal insufficiency can cause adrenal crisis, and thus administration is contraindicated. See, thyroid hormone increases metabolic clearance of glucocorticoids. Treating patients with adrenal insufficiency with replacement drugs, corticosteroids, prior to initiating treatment with levothyroxine. Now think about this. Let's rewind. If there is an adrenal problem, you are not supposed to have any levothyroxine. And here's the point. And honestly, now for all you ladies, because mainly ladies they put on, think about how many people, for example, that are taking levothyroxine right now that have ever had their adrenals tested first.
Probably
Guess how
not.
many?
Zero.
In 18 years of practice, I have never had any woman come in and say, my medical doctor tested me, or my OB, or any doctor in the medical thinking actually does what? Had tested my adrenals before I actually had levothyroxine.
Sure.
And then I pulled up and I show them. No joke. Every nurse practitioner, every medical person, every nurse that's ever worked in the wellness way, I have to explain this to them. Because why? They don't think that way. Okay? So that's the big part where it happens is, so being a chiropractor has allowed me to think differently and now approach these things very differently.
Sure.
And because we're not in the pharmaceutical, basically a robot of take this for this, you say, and it's really funny because I always say this. Think about a doctor that's been in practice for 20 years. Do you understand that most of their medications that they give today are dramatically different over the last 20 years? How the heck do you think
Constantly
they learn
changing.
about those medications? Sure. Not from their education. They learn from some drug rep or some class they take about the new treatments and stuff like that. They're not taught it in school. So that's why you even look at the evolution of it that way.
So what is the big thing that really sets, because one of our other questions, why is there such a big difference between the two? And here's another question. Why aren't they working more in harmony with each other?
They never will. Here, that's why people say, remember the question, I want to look for a holistic pediatrician. You'll never find one. That makes no sense because you can't mix two different things. It's like oil and water. Now, and people say, well, doc, is there time for medication? Yes, there is. You're just going to find out if you actually are doing the right things. It's very rare. It's very rare. Mm-hmm. Not saying you don't need it. For example, one of my patients yesterday, once again, I don't take new patients. Please stop emailing that. I get that about 10 times a week. Doc, I know you're not taking new patients, but you can please see me? No. That's why we have great professionals who do this stuff all over. But she actually had her thyroid removed before she came here, okay? Now, the one thing is this, she was on levothyroxine, and I got our nurse practitioner to do what? To actually convert her to a Nature Thyroid or Armor, okay? Which is a safer form. We can't do that. So that's what we have certain medical professionals within our establishment that can do that, okay? But no joke, most medical professionals, most nurse practitioners, most nurses, everything, they're clueless. They don't even know what Armor or know what Nature is. And if they do know it, here's their catchphrase. Well, we use levothyroxine because we can control the monitoring of it that way. With the other one, we can't. Really? Then why do they have it at freaking Walgreens, you bunch of idiots? That's the excuse that they use, okay? So when nurse practitioners and everything come on, so for you people that are wondering, guess what? They're trained by us. They don't understand it before they get here, okay? So if you look at any of our website, look at all the people that are there, across there, they get trained by us. And the biggest thing we teach them is how they think.
Absolutely. What is the biggest misconception? Because obviously she's had it and I had it one time before as well. There is a really big misconception about chiropractors today that they're just doing one thing, and that is alleviating pain, or you're just getting in an adjustment.
Well, it started really about 40, 50 years ago that way with the ingraining of insurance, because they baited all these docs. Because what happens is instead of charging what they did, they said, well, you can increase your cost, but you have to put these codes down. Just like all doctors get formed into it that way. So even today, you see that today. You know, saying that's why, for example, you say PPO provider, all things like that. And because why? They fall within their realms. They actually give up what they've really been taught to get paid. And I tell people, trust me, do the right thing, and you can get paid all you want because people are sick as a dog.
Yes.
Okay.
And doing the right thing is really what we've come to love to be able to do is what? Give them clinical results.
The end result is that's why I always tell people, come sit in a day in our office once. You say, look what we see every day. You wonder why, for example, we get so frustrated about vaccines and medications that way. See what we see in a day. Do you say, it happens consistently. And here's what happens. You don't have to believe me. Look at the stats statistically. We have higher heart rate diseases. We have higher hormone problems. Everything creates cancer.
Yes.
Everything, autism, everything.
Yes.
And because why? Because their thinking is ridiculous. And that's what separates. And that's where chiropractors are meant to be. The sad part is most chiropractors, they actually said and started to want to make a living instead of actually doing what's right. So,
and they get unmotivated because they become burnt out because they're like you said, they're motivated by the dollar sign
and criticism.
Yes,
most people can't handle criticism. Most say, "I have no problem." Neither any of my docs say, "Listen." If you ask any of our docs, they have no problem saying your doctor's a freaking idiot. Don't listen to him.
Right?
Do you know what I'm saying? Not that we're giving them medical advice, but you got to think about it, and that's the where they differ. So yeah. So guess what? If you don't have a chiropractor in your life, guess what happens? You're on the road to sickness.
Absolutely.
You are.
Yep.
Because everything, even today, even a lot of the natural people, they still think medically. This happens all the time. We won't even do these questions. Ross and I go through these and we'll only do this question. Doc, I have endometriosis. What herb can I take? That is the wrong thinking. That's the medical thinking with natural approach. That's why this whole alternative thing is stupid. The alternative movement is stupid. It's ridiculous. It doesn't work. And they eventually fail it and you're back on medications already.
That's right.
The whole process, you have to understand how the body works, get it tested properly, and do the right things, get it back to normal. And see, and I know it sounds simple, but we've proven it thousands and thousands of times over thousands of patients across the country and continually doing it on a regular basis.
So what this young lady needs to do is definitely go to twwclinics.com and see if there is a wellness way near you or give a clinic a call and get tested.
Well, the big thing, get tested. You know what I'm saying?
Yes.
The reason why you're confused is because a real doctor will walk you through everything so it makes sense. And if it doesn't make sense, run.
Yeah, if you're walking out more confused than when you arrived, there's a problem.
Well, that's what they do. And see, here's one thing. I had a very good conversation with a doc, which actually a medical doctor who I actually care about. Actually, a nice guy. Not that I don't care about the other ones, but you know what I'm saying? It's just that, and he said to me one time, I said, we were talking about stuff, and his biggest thing was losing his authority with his patients.
Yes.
So then if you lose the authority and you're vulnerable saying, listen, here's what it does, and walk them through them, instead of just saying, take this, I'm the authority, listen. I'm like going, the great thing about the internet, the one thing I like about the internet, you can't pull that over people anymore. Now you just have to say, no, enough is enough. Now, the thing is, no joke. I recently just pulled this up really from the PDR on the computer. You can pull it up. Contraindications of any medication that way. Yep. And back to the question, it's only doctors that say is enough, and that's what chiropractic started out was. Actually, chiropractic, if you look at its history, actually was there to oppose this stupidity. And what they do, they got melded in stupidity because of money.
Sure.
You ever look at why things change and why they are? There's somebody that's getting paid for that reason. So
awesome. Great response. Once again, I think it also comes down to is people need to take control of the information that they're being given. They need to go onto the internet because they can find, you can go and look up any of the medications. You can look at the side effects and you can peel back the layers yourself. You don't always have to take it verbatim from the doctor's office. Like you said, if you're leaving more confused than when you arrived,
it's a bad day.
Bad day.
Yep.
Inform yourself, educate yourself, and start asking the right questions. All right, here we go. Question number 2. Doc, I went to my OB with a lot of hormone problems and my doctor did not test me and put me on birth control and then told me to reduce my stress. I'm sure that went over really well. This seems like a quick fix and a Band-Aid to something more that is going on with me. I'm frustrated beyond belief and stressed out of my mind. I've heard of your approach, the we don't guess, we test. I'm wondering how this will help me.
I know why you never let me see one of the questions. Because you just kind of laugh at the stupidity of them.
I know.
Not the question itself, but what they've been through.
Yes.
Do you see what I'm saying? Do you ever notice that every question that we get has some frustration in it?
Absolutely.
They're sick, they're fed up, but see what happens is, and then they accept what their doctor says.
Yes.
Do you see him? And they go, okay, listen, my doctor, you went for hormonal problems. I'd like to know what the hormonal problem was.
Right.
Do you see him? Was it emotional? Was it cyclic? Was it depression? Was it, things like that? And my doctor did not test me. Well, ask them. Number one, ask them, why don't you test me? Okay. It's not like they can't be done. It's not like you can't look it up. And the cool thing about today, actually labs are businesses too. They got smart. You know how they got smart? You can bypass a doctor to get a lab done. You can. Some of the labs, you can actually go to LabCorp or Quest or anything to get some blood work done. You can actually you can even go to Dutch, the test I love, one of the tests, not the most significant test. I just love that test a lot because I do so much female hormone stuff. Like, guess what? You can go to their website and order one.
So what happens if they go to the website and order one and then they have the test done? What are the chances of them taking that test into their doctor and having it read properly?
Oh, they're clueless. You know what I'm saying?
And that's an issue.
Yeah, but do you understand that if they took a Dutch test, which is a very amazing test,
very comprehensive,
and took it to their OB, took it to their endocrinologist, took it to any of those doctors, guess what happens? They'd look cross-eyed. They'd give them the deer in the headlight look. Actually, what happens is, I heard Pastor Mark use the analogy. It'd be like a dog looking at a new dish, kind of like, what the heck is that?
Right.
You know what I'm saying? And you're saying, now remember, you're saying, because I know somebody may not like that statement. Pick your doctor. Anytime he wants to challenge us on the interpretation and what it is that way, I would love to do it that way.
Absolutely.
Because it happened with Nicole. We actually had a recent from the hospital down in, I think it's Fond du Lac or Oshkosh that way, where a doctor said, well, that test isn't really valid. Really? Actually, the government says it's valid. It's certified. It's actually CLIA certified, everything like that. And what happened, he should have said, is I have no clue what I'm talking about. And then, of course, she came here for fertility purposes, and she is pregnant today.
Right.
You know what I'm saying?
Absolutely.
And she's doing amazing that way and stuff. And that's where, for example, this woman's very frustrated. Now, if there's one good thing that he did say to her, reduce your stress.
Yeah, but not on the end of an OB visit,
right,
where you get put on birth control and the one simple response is, hey, reduce your stress.
Right. And really, if I assume we only have, ladies, if you actually send us a question,
only have part of the picture
give
here.
us a little bit more of a picture.
Yes.
Tell us your age. Tell us what the hormone problem was, because we're just going to make some assumptions from here that way. But think about this. As I'm looking at the question right here, is, it's standard. If you don't present with some major disease that they can measure, PCOS, some hormonal cancer that way, what happens is a standard procedure for a doctor is throw you on birth control and tell me how you feel. And if it's too much, we'll change it. If it's too little, we'll change it again. Do you understand, ladies? You're so much experimentation for the medical field today. You are brutally taken care of. There is no science on what they do with you. It's try therapy, try this, and you accept that as science. Do you understand? Remember, scientifically, they told you a lot of drugs are good for you, and they are now illegal today.
Sure.
Do you understand? So stop that insanity. But see, the reason why, and people say, well, just find a new doctor. Good, you find somebody that's just as stupid as he was. That's it. Go to a different OB. They're just as ridiculous. They'll give you the same stupid advice, and they'll give you the same stupid medication, and you'll be just sick as you were before. That's the whole idea of finding somebody different. I guess I'm a little ticked off today.
I would say
all
so,
these
man.
people
I'm
are
loving
just.
it. You're doing. I love it. I'm just going to sit here and watch your facial.
No, I get so frustrated.
You were
because,
like me last week.
Yes. Well, because you see what happens with people today. It's not chance that our wellness ways are so busy.
Correct.
It's not chance that they do so well. They have answers. You know what I'm saying? They have the doctors. I mean, give me a name of any doctor.
Dr. Samson Fennely.
Dr. Samson, Montana. Guess what? He's a hormone whisperer. He does a great job. You know what I'm saying? He can take care of anybody just like Green Bay office. Give me another one.
Dr. Stephen Rumbuck.
Dr. Stephen. Oh,
he's new.
He's new. And I trust him as a new doc out of school
yes.
and stuff like that, being trained by us. He's currently being trained by us. That actually, he's going to do a wonderful job out in the Denver area.
Dr. Jeff Legree.
Dr. Jeff down in Greenville, South Carolina.
Yes.
You know what I'm saying? Wonderful area. Wonderful. I love Greenville and stuff like that. But here's the point. They all think differently. So it doesn't matter, for example, what kind of wellness way doc you go into, they think properly, and then they're going to be able to walk you through these stages that way. You're saying medicine's thinking, for example, is good for one thing, an emergency. If you're dying, thank God we have hospitals.
Yes.
If you're not dying, stay out of there because they're going to lead you to dying. You're saying?
Yes.
It's frustrating. That's the part that really, as 18 years of doing this for 18 years, almost 19 years now, my excitement and passion has not decreased. Neither have any of our doctors that way, because each woman is different. And that's the big thing. Think about this. The biggest thing you ever think about in all of healthcare is this. If we should do this experimental wise and do an undercover video, take 5 women, go into a doctor and say the exact same thing, and guess what happens?
See what happens.
They'll prescribe the exact same thing to everybody that way. They won't do extensive testing. They won't figure out what each person needs. Ladies, listen, or even men, there's not one of you out there that's the same. Doc, I have a twin sister. I can biochemically prove you're very different. Do you say I'm very different?
Yes.
You go through all the things, what the doctor did say, right? You go through all the things like stress. Ladies, this by far, no one's going to convince me to say anything different because I can prove this scientifically. Mental stress kills women faster than anything. It really does.
So does her husband.
Well, that's usually the number one cause
The
of mental stress that way. Which reminds me,
What?
Dr. Jeremy Maxwell.
Yes.
We have our Hormone Connection seminar kicking off down in Columbia, Missouri.
Yep, it's Maxwell Family Chiropractic that
Right.
is a Wellness Way affiliate. Check them out on Facebook.
Yep.
He's got videos going out promoting
The Hormone Connection.
the Hormone Connection.
Well, it's funny because we're almost done with the Hormone Whisper book.
It's awesome.
Okay, and it's the Hormone Connection book, Ending the Battle Between the Sexes. And the writer says this to me. She goes, I thought this was just going to be about hormones, but she goes, it's probably one of the best marriage tools, and I'm going to bring it to my church and use it for a Bible study.
Nice.
Even though there's no scriptural verses in there, just say it should be part of a marriage class.
No, it sets the stage for men and women to really be able to better understand each other and why a woman is as off as they are.
Yeah.
4 times. I'm just kidding. You're not off. But it really, I mean, on a physiological level, you really set the stage for men to understand that woman that they said yes to one time when they should have said yes to 4 different women. And the guy, we just stay the same. Amazing.
Yeah, well, hormonally, guys they roughly stay the same their entire life.
Absolutely.
It's we have this discussion all the time. It's much easier to keep testosterone and other male hormones balanced than it is on a woman. Now, that's what I said. Actually, it's easier to balance a menopausal woman that's hit that age than actually a cyclic woman because their hormones are changing consistently that way. Yeah. But here's one thing: as they're normally changing week to week, physically they change, and actually mentally they change. The example I give women, I say this all the time, and no joke, this is a discussion with women. They'll talk about, breast tenderness, and I'll say, yes, if you think about it, during your cycle, your breast sizes change all the way through the month. And women go, oh my goodness, that's right. And there's nothing wrong with that.
Right.
But with that breast change, because there's a hormonal change, comes an emotional change. And ladies, listen, emotionally, if you think you're going to be the same every day through the course of 30 days, roughly what a cycle is that way, you're putting yourself in due stress thinking that, guess what? My emotions are supposed to be the same. No, your husband's emotions should be the same. So if he's a little orny and cranky and up and down that way, get his hormones checked or tell him to stop being a pain in the hinder. Okay?
Now, you know what you just did? You just gave license to everybody that works here at the Wellness Way to tell me that I should get my hormones checked.
That's right, because you're emotional.
I have a right to be.
But see, so the Hormone Connection seminar, the connection where it came, ending the battle between the sexes, and actually I didn't actually name that. One of Dr. Stephanie, she got married now, so I can't call her Nemitz.
Stephanie Cohn.
Dr. Stephanie Cohn, actually, one of her patients actually started
Came
saying, they came to the seminar, and I just called it, some hormone thing that way. And they said, it helped me understand my husband better. So it ended the battle.
Yes.
We're like, the battle between the sexes,
Yes.
and that's a cool thing. And that's why when this seminar or anything that we able to speak that way, guys, listen, my frustration with medicine, they love what we have to say. The only time they don't like what to say, when if a person comes in and says, Dr. Flynn said this, or Dr. Samson, or Dr. Fennely, or any of those people, same doctor
that we've mentioned. Yeah,
any doctor across the United States says, they said this, and the doctor has a different idea, they try to pull the authority card. Guys, listen, all you have to do is look at the stats. We're sicker than ever. Our lifespan is actually going down.
Yes.
We're on more medications. And if you continue on that path and you think you're going to find a holistic doctor that has a medical degree or anything like that, guess what? You're going to be just as sick as everybody else.
Yep.
And if you think you're going to do it yourself, you're going to be even sicker. You say, because you're just going to do this. You're going to actually watch some YouTube video. You're going to watch some Facebook video, and they're going to sell you a magic herb that's going to make all your problems go away, acting like everybody's the same. It's why some of the biggest supplement sale people in the country, and I could go through their names, but I'm going to be nice. Guess what happens? They sell a ton of products online. And guess what happens? They have a very low rating when it comes to Better Business Bureau. You know why? Because they say this is going to work. They give you all the symptoms that can change, and it doesn't for that person, and now they're frustrated, and now they said that natural thing doesn't work.
Correct.
Well, the reason why the natural thing didn't work is because they treat everybody the same, and their thinking is just as bad medically.
So I just want to kind of go back to this question because I think the question that she has there is, the we don't guess, we test.
Yep.
Is this going to help? And what would she expect if she called in and she came in for testing, what is it that she would possibly see if someone who's dealing with what she's dealing with?
It should be standard as a doctor, okay? For example, if she has a hormone problem, what is it? And on top of it, let's say you even measured. So let's say that someone just decided, I'm going to get those hormones measured by a very good lab. Okay, let's say they did all the testing. They did blood and urine together and got extensive testing. And you gave it to your OB and you gave it to us. Here's what happens. Their course of care is going to be dramatically different, even if they understood the test, even if they understood the test.
Yes.
Because they're going to go to manipulation and inhibition, because that's the only two things drugs do. They either manipulate, inhibit, even if they actually synthetically replace it. There still is the big question is this: why are they off in the first place? Why? Because you can try to balance things. Women, you know this. You've taken hormones naturally or medically that way, and you thought it was the greatest thing on the planet because it made some positive change in your body that way. But it's not long lasting.
Right.
And they come back and go, Doc, this is what happened that way. Yeah, you got to start going after those causal factors. That's actually what chiropractic started out as.
Right.
That's what happened that way. But then they got molded into the same thinking as medicine did. And that's why 99% of the chiropractors out there today are no different than a back pain doc.
Right.
Because they baited them from financially that way. And so it's frustrating. So we're just going to continue to train all doctors, yes, mainly chiropractors, but nurse practitioners, because once again, they don't know anything when they first come here.
Right.
And heck, they don't even know about some of the natural therapies as like Nature Story and Armor. If they do, it's because they read about it, but they don't really know what to do clinically that way. So we teach them, for example, what to do here, and then they can actually now start that approach. But they don't do it from a medical approach.
This is right. This is right. We love the fact that you guys continue to send in these questions, that we get to present you the information more, Dr. Patrick Fennely, because he is the clinical expert that is on this show, not me. You don't want me giving that information. I promise you that, because then you will really need to get tested. But I want to tell you real quick, we have a lot of docs right now that are doing live shows. That would be wonderful for you guys to be able to see. Dr. Jacques Moser.
Cancer last night. Dr. Jesse, Monday morning.
Structured Chiropractic, Dr. Jesse Anderson, the Sugar Daddy, Dr. Jason Nobles. There's
Dr.
a lot
Greg and stuff. And,
the Heart Doc.
Which is kind of cool. He actually named his show The Pulse.
Who did?
Dr. Greg. Wait, no, you did it.
I did. Come on now.
That's a good point. You were the creative genius found that way.
Wow, it's not a whole lot of creativity
actually,
there.
Tonight, tune in to Dr. Thomas and Laura.
Yes.
They're up in Iron Mountain. They're only a couple hours away from here. They do a fantastic job at that. You know
Absolutely.
what I'm saying? And so all these shows across our week that way. And what we're all trying to do in this whole process is give the people who tune in to anything wellness way information so they can make the choice themselves. We're not going to play the authority card and say, we're smart, listen to us. No, we're going to walk you through the process so this becomes not all these darn emails of constant frustration.
Right. It's a beautiful thing. Thank
is.
you, Doc. It's been a beautiful 30 minutes, and your frustration levels are beginning to subside, and I love that.
Well, I said...
Beautiful thing. But anyways, ladies and gentlemen, it's been a beautiful day. Thank you for sharing this 30 minutes with us. Like and share. Continue to invite your friends to come along. We look forward to seeing you next Tuesday, 12 p.m. Central Standard Time. We'll see you then.